important?
Well, for me as both a clinician and a researcher, and that is actually a major hard endpoint outcome for research. And the proper documentation of that is important because if it's improperly documented, you might mislead people, health policy makers, from the actual causes of death, and thus it might affect allocation of resources.
I am Dr. Sherjan Kalim. I'm an anatomic and clinical pathologist from Cotabato Regional and Medical Center. Our hospital is located in Cotabato. It is a small city in central Mindanao. The problem with Mindanao, we have lots of islands in the Philippines. So there are lots of island provinces, as we call it, which is very difficult to go to, and they also have a very poor internet connection. The communication is very difficult. Muslim patients, these are the believers of Islam. We need to bury our deaths within 24 hours. By law, we are also not punished or not sanctioned for not registering the deaths in our places, especially in Muslim communities. In the hospital, we need to release the cadavers without the death certificates, and then we allow them to bury the dead, and then they'll just follow up the death certificates. Unfortunately, most of us does not get any death certificates because most of us do not have insurances. So we don't really need the death certificate. Sometimes it gets time consuming to process the death certificates. So that's why in our hospital, the number of death certificates that were registered is around only 20% of our hospital deaths. Sometimes the diagnosis that we give for deaths occurring at home, which were not attended by physicians, we're just making guesses based on a verbal autopsy. So that is one thing that we still need to maybe formalize. The problem with in the Philippines in general, not just in Mindanao, all over the Philippines, is that the writing of the statement of cause of death is not being taught in medical school. So most of us physicians here, it's not being a part of the competency that we have to.
I'm Dr. Pete de la Pena. I'm the Career Training Officer of Internal Medicine here in the Division of Internal Medicine in National Kidney and Transplant Institute. MCCOD data is important for us because I think it is part of the initiative of the Department of Health because it will be part of their action plan regarding such diseases. For example, if they knew that heart attack or acute MI is very high, they will have their action plan to prevent it. That's the reason it's really part of epidemiology.
I think all hospitals should be able to teach the importance of the proper documentation, not only with our death certificates, I know it's very important, but in other things, because this gives us an actual picture and a real-time picture of what's happening.
So I think part of the training is they emphasize it's really important because they can have the data gathered for us to understand some of the disease. That's part of it. The other ones, of course, the insurance, the reimbursements, and that's the reason why it's really a task for us to understand how to write the certificate of death. And that's the reason why we really went into deeply so that we can understand how to write it.
Most of our maybe experiences or getting knowledge on writing the COD is through our senior residents. But unfortunately, these senior residents are also not trained. So most of them, even the consultants, medical officers, they use diagnoses that similar to the medical chart, which is very, very long. So that is one problem that we face.
The first line of people who actually makes our death certificates is our doctors or our doctors who are here, and just check with the consultants. So I think just for the first line, people who makes the death certificates, we have given the adequate numbers in training, but we should expand also to our consultants. So far in my division, we've done two. We've done two since we started. And every time there are new fellows coming in, we teach them.
Conducted in internal medicine 4 trainings. 1 is echoed by me initially, then 3 were conducted by my residents. It's a year-long process because every year we have our new first years, and that's the reason why it should always be part of the continuum to train them. But our trainers will be the ones that I've taught because they will become seniors, and those seniors are the ones teaching our juniors. So it's a continuum, it's a spectrum. And that's the reason why we always continue the training in the certificate of death.
It's a required attendance for them to listen to us and discuss. And I think what we do, our method of teaching is showing examples. So we show them the errors that we've done in the past, those return certificates of death that was found to be erroneous. We try to explain why this is wrong, because sometimes something that has been learned for a long time is difficult to unlearn. So we have just to teach them again. And fortunately, we have you guys to help us understand this better.
It's that difficult to call our doctors into the training because it is part of our culture and it's part of our training in internal medicine, because it's our prerogative to teach them on how to write the certificate of death. Of course, we have our birthing pains because it's not easy to teach them, but later on, as we go through the line, then we're adept in doing the certificate of death.
You train someone, then after a year they're gone. So it has to be institutionalized that there will be an annual training with regards to this. And of course, if our metrics, I think we put metrics with regards to this, if we receive a lot of return death certificates or questionable encoding on the death certificates, then I think we need to do additional training.
Definitely, we look forward to the expectations, but as of now, we're quite happy because some of our death certificates are not returned anymore, and I think that is part of the evaluation. We look forward to the end of the year so that we can reassess what we're doing. Is the work that we are doing is right? That's how we go for our evaluation.
So I really believe that this is an important endeavor. And I believe that since we are producing a lot of doctors, a lot of fellows, so it's not a one-time thing. It has to be continuous and continues to be evolving.